You come back a couple weeks later, you tell us, is there anything that you can change? Do you want this change, that change, whether it's shade or shape or whatever it may be? When they're 100% happy, we're 100% happy.
Then what? Then you just permanently...
We just take them off and permanently insert them. Right.
Is that right? I mean, people like that, obviously.
Well, oftentimes they'll come back 2 weeks later and say, can you make this tooth just a little bit more rounded over here? Sure. And if it's something we can do chairside, we do. If it's something that we need our great laboratory to intervene with, we do. When that patient is 100% satisfied, then we're satisfied.
You say the laboratory
Yes.
plays a big role in making the teeth look authentic.
Huge.
Okay.
Huge. The laboratory plays a huge role. That's when their ears have to be turned on to what our expectations.
So they make the teeth. They're the ones making the teeth.
They make the teeth.
Okay.
And we are very specific in color mapping, taking hundreds of photos, well, not hundreds, but taking many photos.
A lot of photos.
Taking a lot of photos of the patient so that we can go ahead and give that laboratory as much information as possible so that they can deliver a natural looking, youthful smile. Some people come in with some small flaws that they notice that maybe the rest of us, John Q. Public, wouldn't, but she noticed them. This patient does some modeling. This patient is a business owner. She's very prominent in our community, and she wanted this look, and so we were able to work with her and create this type of smile.
Let's take a look.
Randy, you talked about earlier about you could spot a veneer 25 yards away.
Yeah.
Could you spot those on her?
No. No.
Very natural,
very nice.
natural looking smile. Lip line is there, blends in, looks very neat, and that's a confident person that you're looking at.
Okay. So cosmetic, I mean, has it become mainstream now? I mean, do they come in and say, I want a smile makeover, or they
Yes.
just say, what can you do?
Basically, the internet has been a great tool. The internet's provided a lot of knowledge to our patients as well as word of mouth. Most of our patients come to us via word of mouth.
All right, what frustrates you, by the way, about what's going on in the world of cosmetic dentistry? Because I know you said, look, I want to stay positive.
Randy, I think a lot goes into this in terms of training and differentiation between this dentist and that dentist.
Okay.
A cosmetic dentist has had a lot of training and a lot of expertise in handling these types of cases versus somebody who hasn't. John Q. Public perceives maybe all dentists to be the same.
It seems like you would all be doing the same kind of, cosmetic dentistry. I mean, in a way. I mean, we don't think that much about it.
Correct.
So what do you look for then?
Are all
in a
actors and
cosmetic
actors
dentist?
are all actors and actresses the same? Are all baseball players the same?
But what does the public look for then in a cosmetic dentist? I mean, what do you ask? What do you ask?
You want
of
to
your
know
doctor?
you want to know their training. You want to know what their staff has to say. Ask the staff.
Okay.
Ask the staff. They'll tell you the truth.
Interesting.
Know what
Okay.
type of laboratory they're using. Make sure that it's a high quality laboratory. You want to see what training the doctor has had. Is it up to date? Take a look at their office. Make sure that they're the highest of high tech. And most of all, look at their work.
Okay.
Look
Okay.
at what you're seeing. If you can spot that chiclet 25 yards away, then that's not the guy you want to go to. And Randy, there's another group of patients that I'd like to talk about. And that's the patient that, let's say, the perceived tough guy who's, my gums are too bad to go there. I'm not a cosmetic dentist candidate. They just want to eat and chew. They just want to have functional with their teeth.
Is that the way guys come in, by the way, when it's just at the last minute, they can't take it anymore?
They can't take it anymore. They'll be the silent tear coming down their cheek. I'm a big chicken. They'll say, I'm embarrassed. Can you help me? Of course we can help you. What we're seeing right now is with our Marcellus Shale into play, is we're seeing a lot of people come in from Texas and Oklahoma. Quite often, I'm in pain. Help me. I'm working 95 hours
and they
a week.
have the money. These guys make a lot of money.
They're doing quite well.
Right?
God bless them.
Yeah.
That's wonderful. And we want to help them. And they're coming in, and we're transforming them from not only wanting to eat better and chew better, they're smiling, a little bit more confident, and they're doing well. And
Okay.
we're going out into our community and making a very positive
So
aspect.
more and more men are coming in then for cosmetic
More
dentistry?
and more and more men. every
Real
day.
men?
Manly men.
Okay, you have a photo. This is pretty graphic, by the way. What are we looking at here?
Randy, what we're looking at here is a situation that many people, including the patient, called hopeless.
Wow.
Many people call that a hopeless situation. The patient even said, I know I'm going to get dentures. I'm ready to get dentures. I'm only in my late 20s, but I'm
Late 20s.
ready to get dentures. And,
Is
and
that,
Randy, wait.
I mean, that has to be uncommon, though.
No, this is very common because you don't see those people. They're covering up their mouth like this. You might think they're having a bad day or they're, just kind of honked off of the world, but they're not smiling because they're very self-conscious of what they have. So you really don't even see them. And this is very common. And the patient always comes in and says, I know I must be one of the worst cases you've ever seen. And We see this on a daily basis. And when you see, we kept this guy's teeth. He did not get dentures. These are going to be his teeth that we did.
But what about the gums? I mean, if a guy comes in with gums like that, I mean, what if? I mean, can their mouth be too far gone to have things done?
Randy, there's always something that can be done, whether it's implants, whether it's crowns, whether it's bridges, whether it's partials, always something could be accomplished.
All right, so with him, when you look at that, I mean, what are his goals at this point?
His goals were dentures. His goals
really?
were dentures. I want to be able to eat. I want to be able to chew. That was about it. And his goal was, I want to get a little bit better job.
Interesting, okay.
Yes.
So when do you know that you could even do something? Does it take an x-ray, or can you visually see it and go, this is going to be good?
Well, it's a combination. This was a very complex case where we had to really put our brains together, and our staff worked with me on this, and our laboratory as well, to ensure that we were going to get the result that we wanted to get.
All right, all right.
So it wasn't one of those, I'm an eye up on the street corner kind of a deals. You really had to put some thought into this. And this goes back to, you talked about spotting the chiclet at 25 yards away. I don't think you're going to look at this guy when I show you the after and say, those real, those not his.
So what did you do for him? I mean, what did you do for him?
Well, we did some dental implants. We did mainly some crown and bridge work, and I believe that we transformed this young man's life.
Very nice. Very nice. Now, what does he say when it's done?
Shock and surprise.
Okay.
Shock and surprise. Just total in awe of, I look like this, and now I look like this. And it's a great
It's got to be good for the social life as well.
He's doing great. He's doing great. He has a whole new perspective of life. I mean, every time I walk into him, he's smiling.
But is there a certain kind of a patient that, you know, they're watching this, they don't like their smile, that you'd like to see more of?
Well, Randy, there's always something that can be done, whether it's invisible braces, whether it's crowns, whether it's veneers. We like to do everything in our office. There's always a path available for that patient to go ahead and transform their smile and get better. Whether it's a little thing, whether it's one crown on that front tooth that they just don't like because they don't smile, to one veneer that can transform their entire look and their appearance. There's always something that can be done.
Okay, now on the telephone, and people need to know this is a real interview. I mean, you know, I'm not siding with you. I'm trying not to side with you.
Okay.
But one of the things you said to me on the phone, and you want to make it very clear to me, and I'm going to paraphrase here, but you said, you know, my office, we're about options. That means it's not about one thing or a full set of veneers.
Correct.
That I want to do what they want to do. Elaborate on that.
Correct.
You were feisty about that particular point.
I am feisty about that. And the reason being is, it's that patient smile, and we want to let them guide us, help me, help you, have them guide us as to where they want to go. It can be implants, it can be crowns, it can be bridges, it can be veneers, they can be asleep. We can do the whole procedure while you're asleep with an IV sedation case. Many patients like that because they wake up, boom, they're done, and they're happy, and they just slept.
They don't even remember the procedure?
They don't remember anything.
Okay, okay. So the fear of the dentist, you think that keeps a lot of people from having the smile they've always wanted?
50% of Americans don't come to the dentist due to fear. But we can allay those fears so that it isn't too far gone or too late by IV sedation dentistry.
Now we are out of time, and you have a few more photos. We have time for one more. Okay. Oh,
all right.
Wow.
This is the lady that came into us, and she stated that she didn't go out anymore. She was almost a recluse. She never would leave the house because she was so afraid. And this is a woman who is a vibrant member of our community. And she just said, no, I just hold up in my house. I don't go anywhere. I don't go anywhere. I don't even go to church. I don't go anywhere.
That's hard to believe.
Yes.
I mean, I believe you. I'm just saying it's hard to believe that their smile keeps them from, or their teeth.
Their teeth, right. With this patient, it was total reconstruction of her mouth, where we had to use dental implants, we had to use crowns and bridges to go ahead and project a more youthful appearance. If you look at her after case, and it's very transforming. She's almost not even used to smiling because she went so many years with...
Yeah, it's kind of a grimace, like a forced smile.
Right, because she's not used to it.
So that goes away over time?
That goes away, absolutely, yes. As well as speech issues and everything.
Okay, so take me through the process as a recap here. Patient comes in.
Yes.
How do you decide, or how do you give them a picture of what their smile is going to look like? Do you have like a smile catalog? Do you show them pictures, digital imaging? What do you do?
We do a number of those things. We go ahead and we can provide them.
So I'm the patient. I'm there on day one.
Right. You come in day one. We do our diagnostics. We take our photos. We take our X-rays, et cetera, and then we have them come in. And we say, look, these are some of the things where we can guide you to. This is some of the work that we've done previously on cases that are similar to yours.
Okay.
This is what you may look like. We can take a digital photo here, and this is what you know, in general, this is what you're going to
So
do.
you show them other patients that have similar smile
Yes.
problems?
Yes.
I mean, could you usually find that, by the way?
Oh, of the hundreds of cases that we've done, yes.
All right. Okay. So they see it, and then what happens?
They see it and they say, that's the one I want to look like. That
Really?
one. Right. So, okay, so you want this type of, exactly, that looks so natural. She's about my age. That's about 40-ish. That's what I'm going to look like, yes. Then we go ahead and we talk about having a test drive where they're in control of how they look, that until they're 100% happy, we're not
So they
happy.
try out teeth for a test drive?
Test drive.
Okay.
Yes. So what we do is we have them come in, we go ahead and place them in temporaries so they can go ahead and sort of get used to that feel, get used to that look, have them come back in, put the permanents on with a test drive, making sure that they're happy. They go out into the world, they come back in to see us, and we make any adjustments necessary.
Okay, great. So now, final message. I mean, to somebody, they're out there, and would you say that there's thousands of people in Pittsburgh?
Thousands, yes.
Tens of thousands
Tens of
that
thousands.
hate their smile?
Hate their smile, afraid of the dentist, don't want to be there. It's the last thing I want to do. Help me, though. I want to look better. I want to look more youthful. I want to help my parents. My spouse is making me come in.
Okay, you know how sometimes people are afraid of the surgeon, like all they think is surgery.
Right.
Well, if you're, you know, we say Pittsburgh's cosmetic dentist, you're the go-to guy. Do you think that's also intimidating, that all he's going to be thinking is veneers, or all he's going to be thinking is do the whole mouth?
Well, there are many different approaches, and we try and keep many options available to our patients. They guide the process. They're the ones that are going to make the decision. We provide them with options. Here's one, here's two, here's three. You help figure out what you want to do, and we'll get you there.
Now, do you find that when you fix people's mouths, their smiles, that now all of a sudden they start coming in and they almost have like a bug for dentistry, where they're coming in every 6 months for cleaning?
They love going to the dentist. They love. They do. They
do you ever hear that? They go, "I love coming here."
I love coming here.
Are you kidding me?
I love coming here. It's easy. It's fun. Your staff's fun. You make me feel welcome. And they have nothing that needs done because it's been done, and they maintain it. It's just like a car. Maintenance is cheap. Treatment is expensive. And they're now in a maintenance phase.
Of everything you do, I mean, what do you like most about what you do?
I love going to the grocery store, seeing a patient, having them come up and give me a hug and a thank you. I love seeing the patient at the ball field who says, and they
do they do that?
They do that. They point, and seeing them at ease, and seeing how maybe they were a little shy or a little inhibited, and now they're the life of the party. It was always there. We just help bring it out a little bit.
Well, good for you. Thank you for coming on the show. Good
My
stuff.
pleasure.
Great
Thank you.
stuff. And the before and afters are on your website.
Yes, they are.
Is that right? And so when you want a natural looking smile,
Come to see us.
consults are free, by the way?
Consults are free.
They could go in, you give them an idea.
We'll give them an idea, give them some options. Consults
Sedation's available.
always available. Yes.
Okay, good. Thanks again. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go to our website and put in Pittsburgh Cosmetic Dentistry. You could put in Dr. Bartusiak, which is probably tough to spell.
Right.
But you could just put Cosmetic Dentist, Pennsylvania. We'll put those tags so they could find you easy there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.